Here's how you're gonna stop gum disease. Gum disease is basically the process of the underlying bone that shrinks down over time and gets destroyed, and then your gums shrink down and you have things like gum recession, bleeding gums, red gums, irritable gums, gums that hurt, and different signs that you have gum disease. And it's actually a huge problem. And most people don't realize this, but once you have a problem with the gums, you actually have a bigger problem, which is the bone underneath. We have no way of putting the bone back. So once the gum has receded, that already means that you've lost bone and we can't put it back. We just have to halt it where it's at, and we have to stop the progression of the disease. And today I'm gonna show you a bunch of different ways of how to stop this. All right, number one is recognizing it. The very first thing is recognizing that you do have gum disease. Now, if you have gum disease, you're gonna see things like bleeding gums, irritable gums, gums that hurt. Gums shouldn't hurt. That's not a normal thing. Gums should not hurt, and they should not be red. Red gums usually means irritable gums, which means that there's a problem below them, which again is the bone underneath. Or you could just get some popcorn stuck there from the movie theaters, and then once you get that out, it's not gonna be red anymore. But most of the time, it's not just as simple as you have something stuck in between your teeth or jammed down in there like a popcorn kernel. You could also have really stinky breath. Having bad breath is a symptom of gum disease because the bacteria is so bad and it gets wedged underneath your gums, especially if you have tartar or calculus buildup on your teeth that needs to be removed. That is going to smell really bad and it's not going to be good. You're going to notice a change in your breath. You're going to go from having like normal breath or not having any problems with it to just really nasty breath. And when you exhale and people comment all the time that you have bad breath, it could actually be a problem more with the bone, which is a gum disease, than it is actually with the gums or your actual breath. So treating this is really important. Also, a change in your bite. If you have wiggly teeth, it's gonna change your bite. If you have teeth that actually hurt, let's say 3 or 4 of them all in a quadrant. Now, the hard part about gum disease is that it can't be cured. There is no cure for it. We can't build it back. It is a progressive disease that accumulates over time. Basically, if you have healthy bone, and as you age and as you have all these different risk factors that I'll cover later in this video, your bone is gonna shrink down and down and down. Now, that is really scary because we have no way to put it back. So once you have really severe disease, we don't have any way of putting it back. So once the disease has actually taken over the mouth, you could have things like wiggly teeth, loose teeth, and when you lose so many teeth, it's really hard as your dentist to tell you, we actually have to pull all of your teeth and put you into dentures because the disease is so far gone. There's nothing that I can do as your dentist to help you. And it's the worst thing in the world for me to tell patients, hey, we actually have to take out some of these teeth because your teeth are so far gone. It has been delayed so much by you, or maybe you couldn't afford to go to the dentist, or maybe it's been 5 years since your last cleaning and you just had no idea the teeth weren't hurting, they've had no problems, and now you have teeth that are swollen, you have all these gum problems, and I have to inform you that, hey, we have to take out like 10 different teeth because there's nothing that I can do to get you out of pain. We just have to take these teeth out. So it's a pretty nasty disease, and it's very important that you stay on top of it and you don't neglect it. If you neglect some of these signs, you will be sorry down the road because dentistry is really expensive, and down the road 10 years, it's gonna be insanely expensive. So deal with it now, and then you don't even have to even go to the dentist and get a lot of treatment done. You can just get this done by your hygienist. The second thing is just to get a deep cleaning. Now, a deep cleaning is not a regular cleaning. Regular cleaning, we're basically cleaning above the gums. A deep cleaning, we're cleaning above the gums, but we're basically planing the roots of your teeth. We're getting rid of all of the bad bacteria underneath the gums. Now, the bad bacteria has accumulated there over time, so we're gonna use things like an ultrasonic scaler. We're gonna use water. We're gonna spray water. We're gonna use antibiotics maybe. Sometimes we're gonna have to get you numb because cleaning underneath the gums is actually kind of painful. When we do this, you notice your gums are gonna bleed a little bit. You notice that it's gonna be a little bit uncomfortable. Your gums are just gonna be sore after the cleaning, but that's why we call this a deep cleaning, because it is definitely different than a regular cleaning. A regular cleaning is every 6 months. A deep cleaning is every 3 to 4 months, which leads me to my next point. Listen to your hygienist. They are basically like your oral health coach. They're gonna guide you along the way. So if you're doing a bad job on brushing, they're gonna coach you. They're not gonna make you feel bad about it, but don't be embarrassed to tell them like, hey, I really can't reach these back teeth very well because I can't get my fingers around the floss and I have a limited opening, whatever it is, gag reflex. I can't floss back there very well. Your dental hygienist is gonna help you and coach you along the way and make your life a lot easier and actually make your oral health better because you're gonna listen to them. That's another thing that's crucially important, is that you listen to them. If they want to increase the frequency of your hygiene visits, meaning your cleaning visits, please do that. Now, I do have some good news about your deep cleaning, is that you don't have to get your deep cleaning every single time you come into the dentist. These cleanings are very expensive, and yes, sometimes you're gonna have to spend a little bit of out-of-pocket money and not depend on your insurance, which is not gonna cover the cost of the entirety of all the deep cleanings anyways. The third thing you can do for gum disease is get LANAP, which is laser assisted root planing. Basically, it's a laser assisted way to clean and plane the roots of your teeth. Now, all the bacteria is underneath the gums, which is on the roots of the teeth. That's the source of the problem. So there's a bunch of different ways we can clean this, and with a laser, we can target specific bacteria and clean them in a way that is sometimes more advantageous than just scraping on the teeth and actually cleaning your teeth by hand or with an ultrasonic scaler. So LANAP is a great procedure. It's not for everybody, and yes, it is expensive. A lot of times insurance don't cover it, but that is okay because it is used as an adjunctive procedure. So an add-on or something that we can add to your normal procedure. Let's say we're just losing ground on your teeth cleanings, then we use LANAP and bam, you're back to square one and we're not losing any more ground. Now we can put that aside and we can actually just do those periodontal maintenance cleanings, and we don't have to do those anymore. So it's not like you have to do the LANAP procedure every single time. Sometimes we can just jumpstart your oral health and then we put it away, we don't have to use it anymore. The fourth way to stop gum disease is to actually just see a gum specialist. Now I know when you say the word specialist, people get a little bit worried because the word specialist equates to the word money, and a specialist means that it's gonna be very, very expensive. And I know that people are really worried about that. Whenever I refer patients to a specialist, I know that's what they're thinking. When I refer patients to a specialist, I know the first thing they're thinking is, I don't want to go. I don't know that person. I don't trust that person. Doctor, I trust you. Can you do this? Doctor, I trust you. You're the general dentist. I trust you 100%. But sometimes it is so progressive, the disease is so progressive that I myself cannot treat it on my own. I need help. I need a gum specialist to help me. And the best gum specialists are called periodontists. They are specialists in gum and bone. Basically, if there is major bone loss, major gum disease, they're the ones you want to see. If you have pocket numbers, and I'll explain that a little bit later in this video, that are really high, 7s, 8s, 9s, even 10s plus, let's say a 12 millimeter pocket, your tooth is about ready to get lost. And so instead of pulling that tooth, we want to maintain every single tooth for as long as we can. So we send you to a specialist, and a lot of times those specialists will treat you and they'll send you back to us. So the communication between the general dentist and the specialist is absolutely crucial. There you go, 4 steps to eliminate gum disease. Hopefully this video was helpful and you learned a lot of different. If these videos are helping you at home, please leave a comment. I would appreciate it very, very much. I read all these comments and I just want to help as many people as possible. As a dentist, I took an oath that I would help people, and I have 1,600 active patients in my practice, but I want to help hundreds, if not thousands of people, maybe millions of people across the world. So if these videos are helping you, please comment below. It not only helps the algorithm, but it also helps me realize that I'm actually helping people via the internet. So me sitting in a room by myself with nothing around me, I can actually help people at home, which is pretty cool that we live in a day and age where we can do that. I'm just a dentist. Thank you for watching.